Me and Doc talks.
Okay, I'm going to have a little trouble getting Doc to talk about this one. There's a new kind of fat transfer cosmetic surgery that uses fat transplants from dead people. It's also known as zombie BBLs. Let's see if we can get Doc to talk about it. Doc, what's a BBL?
Well, Mimi, I'm just flabbergasted at the kinds of things you get me on here talking about.
Because you're the expert, come on.
Yeah, whatever. All right,
Okay.
so here's the thing. For women with the smaller derrieres, the smaller hind parts, the smaller buttocks, present company excluded here, there are techniques that are used to kind of enhance the appearance of a woman's behind. They're called Brazilian butt lifts or BBLs. What they involve is making it so that you can surgically increase the amount of buttock tissue that's visible under your pants or your underwear or thongs or whatever. The ways that I've seen it done, I don't do these procedures. I'm not an expert in them, but I've seen their complications from time to time. They come through my practice.
Tell us about that.
What these involve ways of lifting up the fat behind the buttocks, underneath the buttocks, to make the buttocks appear more prominent. People write songs about this stuff.
Okay, let's not get carried away.
So Mix-a-Lot wrote the song,
Okay, see,
Baby Got Back,
I knew this would be a problem.
for that reason. Okay, I got some feelings about that. So here we go. So here's what I've seen done. I've seen people make cuts in butt, cheek, if you will, and insert little pads that expands, much like pads that women use in the brasiers to expand their mammary glands and make them appear to be bigger. I've seen those. I've seen those go wrong. More recently, what I've seen is plastic surgeons would use transposed fat. So a woman's own fat, for example, from around her abdomen, around her belly button, underneath the armpits, like my co-host is doing here, and take that fat, process it, and inject it underneath the buttock muscles in a way that can smooth out and round out the buttocks. You've got a problem with that because you've got to get it done right. It's got to be symmetric. The left and the right buttocks have got to look the same. There's a whole process about making that work, and it's not covered by your insurance. So women have been paying money to get this done so their butts can look better.
Okay.
I don't know why. Now, I understand that women that have natural defects in their skin and their buttock skin, maybe they've had melanoma surgery, maybe they've had, a pit bull bit a chunk out of, buttock tissue or whatever, and it looks asymmetric or deformed. I get it that those women would want to have some kind of augmentation to help things look pretty normal, especially under pants, for example, or so forth.
Okay, so then basically what you're saying is that a traditional BBL either uses a woman's own tissue or uses something like a breast pad to enhance the appearance of her buttocks.
I'm not an expert. That's what I've seen.
Okay.
More commonly, when you refer to the cadaveric, and so cadaver, we've had a long history in medicine of using cadaveric, which means deceased individual tissues, to harvest things like kidneys, lungs, hearts, corneas, tendons, and even fascia to use with people who are still alive in order to keep them alive. So heart transplant is someone whose heart has completely failed. They would die if they didn't get the transplant. You can use a heart from a donor, a cadaver. A cadaver is a deceased individual who gave their permission to use their body tissues for medical science. They've signed a donor form, for example, their driver's license. You've seen those.
So generally speaking, it is safe to use tissue from dead people.
Yes, it is safe, and there's a long track record of it. And in fact, when you look at harvested tissues from cadaver, if you go back to, I don't know, the 1960s, where the first heart transplant was performed, or 50s, I can't even remember. It's
This
a long,
is upsetting for Doc.
yeah, it's a long-standing tradition of being able to use cadaveric tissue to save and continue human life in settings where, the transplant would save a life. It's been done, it's known to work, and it's worked very well.
So let me ask you a question. When it's not a whole organ like a heart or a lung or something like that, and it's more like a piece of skin or a cornea or maybe a blood vessel or a valve, that doesn't require anti-rejection drugs or something like that, is it safe?
So the answer is yes. So let me answer that question. So when you have whole organ transplants, like kidneys, like livers, like hearts, for example, there's vascularity, there's blood vessels, there's immune tissue in those organs. So when you implant an organ into another person, the immune system of the recipient will react to that organ as a foreign body and will attack it. So in that setting, there's anti-rejection drugs that are used to keep the immune system from attacking the transplanted organs. And there's other things like graft versus host disease and so forth that the implanted tissue fights with the environment, and the environment fights with the implanted tissues because they're not the same. The fingerprints, the immunogenic fingerprints are different, and so your immune system is designed to fight that.
Right, but apparently...
When you use fascia, when you use cornea, when you use tendons, for example, or skin...
Or fat?
Or fat, that tends not to be blood vessels and vascular components, and so it's not immunogenic. So routinely, in our business, for example, in urogynecology, we use fascial grafts to help treat incontinence, for example. If you take a fascial graft, it's safe, it's scrubbed, there's no genetic material in it, it doesn't trigger the immune system. You can use that graft safely without anti-rejection drugs.
So you can take a graft from a dead person and use it in a urogynecologic procedure.
A sling
pretty
procedure,
safely.
for example, safely, yes.
Okay, so I've heard a lot about mesh.
Sure.
And that mesh is used far more often than biologic tissue, but there's some issues with mesh. What are the issues with mesh?
So mesh is synthetic material, usually made from polypropylene, which is a distilled petroleum product, similar to plastic, that is treated in ways that make it non-immunogenic, supposedly, that it's used to reinforce tissues when you do prolapse repair or urinary incontinence. It's pretty much considered a standard of care. Risk benefits and alternatives have been discussed at length. There's tens of thousands, hundreds of thousands of procedures done with mesh. Mesh has been treated in a way such that it behaves well, especially when it's planted either abdominally, as in prolapse repair procedures, or placed as a retropubic sling in the appropriate setting. However, there's women who say, I don't want mesh in me for whatever reason. And in those women, we have the alternative of using either cadaveric tissue, which tends to be not immunogenic, which has its own collection of problems, or in our case, in our practice, maybe we use a patient's own tissue to replicate and create the grafts that solve the problems of prolapse and urinary incontinence in the same way that someone would use fat transfer from one part of the body to, for example, the breast to augment the breast. It's the same concept.
Okay, so you specifically use this, use a woman's own healthy, strong tissue to create a sling for prolapse. And to learn more about prolapse, please go to our website, www.mypfi.org, where we have a number of blog posts and other videos explaining what prolapse repair surgery is. But what you're basically saying is you can safely use your own tissue, very safely use your own tissue, and you can pretty safely use cadaver tissue. So I think it's safe to conclude that with a long history of cadaver tissue, it is safe to use. I guess our next question is it ethical? As Christians, how do we have to view the use of cadaver tissue? And you did tell me an interesting story about the use of cadavers in medical school. Why don't you tell us more about that?
So the use of cadaver tissues is an interesting situation. A cadaver is a deceased individual. A cadaver, a person before being deceased will sometimes or often sign a form donating their bodies to medical research. Once they sign off on that, that makes them eligible to be a donor for any purposes. You've seen driver's licenses where you say you're willing to be a donor. Some people sign those licenses where they say, yeah, let me be a donor. If I'm brain dead or whatever, you can use my tissues for medical research or progress or whatever. So having cadaver donations is a standardized procedure that's used in order to take deceased tissues and use it for healthy people to keep them alive.
And also in
considered
medical
normal.
training.
In medical training, what we've seen it done is for people that donate their bodies to medical research, a medical student in medical school would be able to participate in a cadaver lab because that's important for understanding dissection and anatomy and so forth. We did them when we were in medical school. I believe they still do them. And what I recall is at the end of the semester or the teaching period, there would be a ceremony that allows the interment in a respectful, ethical fashion of the cadavers with, cremation or whatever the case may be. Those cadavers
So there
sent
was
up.
some ethical discussion about the treatment of the remains and the treatment of the individual's bodies, because we as Christians believe that we are made in the image of God and that our bodies are sacred and should be treated with sacred respect.
That is correct. And I think in Western thinking process, thinking of the tissues as sacred and treating them with respect is part of our heritage and part of our ethos. That's what we've done here.
I guess the conclusion that we can draw is if there is a good reason, a justifiable reason, that you need to use cadaver fat to restore your body, that is something that you should do. But if it's purely cosmetic, you may want to discuss it as a Christian with your pastor to seek counsel on whether that's an appropriate use of human tissue, because our human bodies are images of God, and we should take that very seriously.
Well, Mimi, you got me again. There's another one that I've gone through with you that I don't know how we did this, but here we are. We've gotten to the end of it, and I'd like to thank you for having me on board.
Thank you for your willingness to have this discussion. Thank you for enlightening us. And to learn more about our mesh-free surgery, please go to our website, www.mypfi.org. Like and subscribe, and share this information with someone that you might think can be helped by it. Thanks for being with us.
Thank you, Mimi. It's my pleasure.
Thank you.
Mimi and Doc Talks, it's the best news you ever seen. The light Fox, real gospel. Just hop in, don't talk, listen. Faithfully so you love it, can tell that you paid attention. Mimi and Doc Talks, it's the best news you ever seen. The light Fox, real gospel. Just hop in, don't talk, listen. Faithfully so you love it, can tell that you paid attention.